Thank you all so much for joining us for January's clinical update. My name is Dr. Katie Liveoak, and we'll be discussing BioDetect and identifying non-urine substances. The objectives for today will be define the role of BioDetect, list the characteristics of synthetic urine, demonstrate the impact of BioDetect testing with Aegis specific data, and interpret urine specimen reports with unexpected BioDetect results. This is our BioDetect logo. BioDetect is proprietary to Aegis and is an expansion of our specimen validity testing. This slide just goes over high-level information. The main thing that I wanted to point out is with the expansion of drug monitoring practices, specifically in urine, this really has led to more opportunities for individuals to attempt to beat urine drug test. And this has led to an uptick and a significant increase in availability and use of synthetic urines. We know that the sales of these synthetic urines have soared and are recently being believed to be over $1 billion in revenue for the manufacturers. And so, kind of giving that high level information, we'll go into some specifics related to BioDetect. So as I stated before, BioDetect is expansion of specimen validity testing. When you think specimen validity testing, a lot of things that will come to mind are specific gravity, creatinine, pH. This will fall underneath that umbrella. Our BioDetect includes unique markers that are expected to be present in routinely analyzed human urine. And when those markers are not found, we will place on a report a not expected BioDetect result. This will then assist a provider with identification of a substituted or potentially synthetic urine specimen. We do perform and report BioDetect on all Aegis urine samples. Specifically related to synthetic urine, we will talk about kind of what the manufacturers include, things such as the creatinine, the specific gravity, the pH. They also, when they manufacture these products, ensure that they have similar color and density as human urine. So thinking about a specimen where you've used a synthetic urine and are only checking for things that are listed here, it could very well pass as a normal specimen when in fact it is synthetic. So that is the advantage of using the BioDetect, is that we're able to capture and identify potential synthetic urines. They come in powder and liquid formulations and include instructions, heating pads, temperature indicators. They are alarmingly accessible, sold in smoke shops and on reputable sites, things such as Amazon and eBay. You can also buy them directly from the manufacturer's website. While I'm talking about BioDetect and our ability to detect synthetic urine, I do also want to emphasize we are able to identify any non-human urine substance. So think about things like water. These products are of concern because the creatinine and the pH are normal, but I didn't want to miss the opportunity to ensure you that our BioDetect will also detect products that are substituted, that are not synthetic urines. These are just a few of the many products that are available online. The green box there in the bottom middle of the slide that says sub-solution is mentioned often online and sold by a company called Test Negative, and is touted as kind of the biggest and most popular online store selling synthetic urine. Most of these websites come with complete directions. They will explain how to use their product, how to heat and warm so that it passes temperature checks. They come with different accessories, I guess you could say. So top right hand corner here, looking at products that you can buy that include a leg strap or stash undies. These are devices or accessories that would help with observed urine collections. Thinking about cost, synthetic urines I saw could run anywhere from about $15 for about 10 mLs of the synthetic urine to an upwards of $350 for gallons of a synthetic urine concentrate. This chart demonstrates the frequency of the top 10 prescribed medications by class in samples with unexpected BioDetect results. This is Aegis specific data. The data includes over 1.9 million urine samples collected from January of 22 to October of 23, with about 8,600 of the reports with an unexpected BioDetect result. And what you will see here is we do have a line item which is right at about 4,000 where nothing was prescribed and nothing was detected. That doesn't necessarily mean that there wasn't anything prescribed. It just wasn't noted by the provider at the time that they submitted the sample. But what you will see is that we have drugs that are in the medication assisted therapy space, as buprenorphine, methadone. You've got your opiates, opioid antagonists, and then you have a lot of psychotropics. So I think what you're representing here is that unexpected biodetect results, while they can be found in a lot of different arenas, tend to kind of hit three buckets, and that's your kind of pain management, chronic pain management, substance use disorder, namely opioid use disorder, as well as your behavioral health arena. So, already really high risk populations. The following illustration here categorizes the same data set as the previous slide, but gives you the percent of urine specimens with unexpected biodetect results based off state. So the darker the green shade, the higher the percentage of unexpected results that we found. So you see the highest results were found in Wyoming, Alabama, and Georgia. Wanted to provide some statistics here just to help kind of emphasize why a technology and surveillance and testing of biodetect is important. I want to start with the opioid epidemic, and particularly because of the impacts here on those that require chronic opioid therapy to manage their pain. So medication non-adherence and substance use can go unnoticed, and these individuals receiving treatment may be at risk for negative outcomes. Data that was gathered by the US Department of Health and Human Services from 2020 showed that 1.6 million individuals had an opioid use disorder and over 10 million individuals misused prescription opioids, and that over 70,000 individuals died from a drug overdose. The HHS also reported that approximately 75% of those drug overdose deaths in 2020 involved an opioid. So while there's progress being made, and we know there has been to curtail this epidemic, there still remains an unfortunate uptick in overdoses and hospitalization secondary to opioid use. The growing availability of novel psychoactive substances, specifically your designer opioids. So, thinking about fentanyl analogs and nitazines, this is also complicating the issue because now you have substances of varying concentrations and strengths that can significantly increase the risk for overdose when taken in combination with prescription drugs. So, As providers navigate this landscape, identifying sample substitution and the use of synthetic urine is going to be definitely important to help guide their treatment decisions. In the middle of the slide here, you'll see the rates of adults in the United States with substance use disorder is startling. It's doubled from 20.4 million in 2019 to 40 million in 2020. Then in 2022, the National Survey on Drug Use and Health is now reporting 48.7 million people aged 12 and older met criteria for substance use disorder. And then lastly on the slide, looking at mental illness and the increase in its prevalence with rates of close to 60 million adults in the United States experiencing a mental illness in 2022 compared to 45 million adults in 2016. So the information offered by BioDetect in this setting is going to allow us to appropriately assess and treat individuals in behavioral health and also assess for adherence. I wanted to show a couple of examples. This is going to be the first example, high-level information about our samples. The first will be just a list of the medications the individual was prescribed at the time the specimen was submitted. The next section is going to be a medication compliance box, and then you'll see there our BioDetect results. I have circled this one here red because it was listed as not expected, which means that we did not detect the biomarkers, and so it's not consistent with routinely analyzed human urine. And then you see more of your standard specimen validity testing, and I've highlighted these here with the red circle to indicate the creatinine and the pH are normal. This result was in a pain management setting and reflects non-adherence with prescribed medications. So the individual, had you not had BioDetect, the provider would think, I've got an individual who just isn't taking their tramadol or their hydromorphone, the gabapentin. You see the list there. But with the sample having a concomitant unexpected biodetect result, demonstrates the inconsistency, like I said, with routinely analyzed human urine. And that's going to inform the provider that you cannot apply this objectively to any type of adherence. So the unexpected biodetect result provided direction to identify either diversion, substance abuse, or determine causes of non-adherence. One thing I did want to mention, because this will occasionally happen and our team gets questions about it, is we will get an non-expected biodetect. So you know that what was in the urine cup was not urine, but we will still see substances, things like cocaine or methamphetamine present in the sample. These provide a more difficult interpretation, and a lot of times we are able to give scenarios. One in particular that's recently been considered is that the individual who brought in the synthetic urine or the substituted sample transported that in a container that maybe had like the cocaine or methamphetamine residue in the system. So that's just an example. But just want to emphasize again, if you get a result of a non-expected biodetect and you have questions, our number will always be there. Please feel free to give us a call and we can help kind of answer questions and provide interpretation for those situations. The second example is an Aegis report that was collected in a substance use disorder clinic with an unexpected biodetect result. The patient was prescribed buprenorphine and naloxone, and when you look at our medication compliance box, you see that both of those exceeded our upper limit of quantification, and then the buprenorphine here was flagged with our low metabolite comment. The individual that submitted this sample may have substituted the sample to mask the presence of another ingested substance, so attempting to hide potentially an illicit substance could potentially be an example here. These findings, though, do suggest post collection addition of the buprenorphine and naloxone product to the specimen in an effort to appear adherent. The one thing I do want to emphasize with the metabolite, so the metabolite that we detected here was a very small amount of norbuprenorphine, and it is thought that the heat that the individual uses on these products to warm either the synthetic urine or to warm whatever substance they brought in. The metabolite is just a degradant. This is more likely to happen with our metabolites, and so that is why you see this low metabolite. So the individual provided a sample that wasn't urine, placed a small amount of brand name Suboxone type product into the sample, and then the heating of the sample caused a low metabolite to show positive. So without BioDetect, the possibility of relapse in addition to non-adherence may not have been considered and the risk for negative outcomes may have been missed. But because we have the BioDetect testing, the provider was able to gain more insight into the situation and guide risk stratification and consider possible referrals for additional treatment. In summary, BioDetect, we're going to help us identify samples that are not consistent with routinely analyzed human urine. Medication non adherence and substances may go unnoticed otherwise if you aren't checking BioDetect. Providers are given clinically relevant information so that they can make more informed decisions and improve treatment outcomes. And providers um, are given greater insight into potential substitution and allowing them to mitigate risk and make treatment decisions with greater confidence. And with these synthetic urines, as we discussed earlier, just being accessible for at risk individuals in the pain management realm, substance use disorder, and behavioral health arenas, and them being used to mask non prescription drug use or hide medication diversion through the substitution, that identification of appropriate medication use, substance misuse, and even medication diversion is so very important and is key not only to effective care, but ultimately mitigating the risk for potential overdose. This is our clinical team, and I've provided our telephone number and our email at the bottom of this slide. This is a dedicated phone and email for the team. And so if you all have questions related to BioDetect in general, or you have a sample that has a not expected BioDetect result and you have questions, we would be happy to discuss those with you and answer your questions. Thank you all so much for attending today. And again, please reach out if you have additional questions or need clarification on any of the material presented.